Welcome once again, and this time in this chapter, we will be going over psychological disorders and we'll be breaking them down and being specific about being able to tell the difference between some of them. You know, first we need to talk about the concept of symptoms. What is a symptom? A symptom, very easily, it's just a departure from natural functioning or feeling. Anything that strays away from what is a natural function or a natural feeling, departing from that. Now, one of the things I want to elaborate on in this chapter is the difference between two terms. Now, what we're going to be talking about today are disorders. Disruption to regular body structure and function, like OCD, narcissistic personality disorder. These are disorders. Now, I don't want you to refer to, some of these concepts as diseases. We're not going to be talking about diseases. We're talking about disorders. A disease, abnormal condition of body or mind that causes dysfunction or discomfort, like heart disease or Alzheimer's, and it could be caused by nature or it could be caused by nurture, one or the other. But today we're going to be referring to disorders, not diseases. We're going to be talking about psychological disorders, clinically significant disturbance in cognition, which is thinking, emotion regulation, which is feeling, and behavior. So, psychological disorders, disturbance in thinking, feeling, or behaving. Now, in this chapter, in this presentation, remember, we're going to be focusing on what's in yellow for the exam, and anything that is in white is just extra information. Such thoughts, emotions, or behaviors are dysfunctional or maladaptive. They interfere with normal day-to-day life. And the dysfunctional person is often distressed. So we're going to be elaborating on psychological disorders. Now, when we're referring to biological disorders, we see a chart that could be influenced by a trifecta of things. One of them could be biological, right? What you inherited from your parents, the biological influences. There could be psychological influences, maybe because of the stress in your life or the trauma that you've had to endure, or maybe because of learned helplessness that has occurred in your life. And the third thing that could influence psychological disorders are the social cultural influences, like the roles and expectations that come from your culture and your family. A little bit of extra information. Now, how and why do clinicians classify psychological disorders, and why do some psychologists criticize the use of the diagnostic labels? All right, so how do we even classify disorders? How did that even come to be? The diagnostic classification in psychiatry and psychology, what it's trying to do is predict the disorder's future course, suggest appropriate treatment, and prompt research into its causes. Okay, so that's kind of why they are labeled, but let's talk about classifying them as well. Now, how do you classify what an individual is suffering from? Well, there is a book called the DSM-5, made in 2013. Now, as the years go on, there'll be a DSM-6 and a DSM-7 and so on and so forth. But the DSM is the most common tool for classifying disorders. Okay, what these little acronyms stands for, the DSM, Diagnostic and Statistical Manual of Mental Disorders. Now in the 5th edition, why it's the DSM-5. So this manual essentially has a list, and it classifies all the disorders that could exist. It is published by the American Psychiatric Association. It describes disorders and estimates their occurrence. Basically, it's a manual, exactly like the title says. Each time there is a new manual, sometimes they'll add things that are new to the culture, or they'll take away things that are now outdated, because we're always doing research and we're always learning new things and we're always trying to find out more and more. So some of the new categories for the DSM-5, a hoarding disorder, right? Some people, they cannot throw away wrappers and old candy bar wrappers and bags from Chick-fil-A or whatever. They can't bring themselves to throw it away. Or binge eating disorders. So these are the new categories. So this manual is updated, and you can actually get it at any bookstore. All right. Now, what are some of the criticisms of the DSM? Some people do have some criticisms for it. Some people say, well, it casts too wide a net, meaning, well, it's just too broad. You could be talking about anything. Some psychologists say, well, you're constantly diagnosing everyday life, right? You get to the point to where you're feeling one way, and then, well, I got to look that up on the DSM. And the third one is labels are or may act as society's subjective value judgments. So if you are diagnosed with something, then one criticism is that label, whatever it is, it's going to be society's value judgment on you. Like you're placed with a label and you're walking around with a label. The benefits of the DSM, it does help mental health professionals communicate. Like they can talk to one another and say, well, this individual suffers from narcissistic personality disorder. And then, okay, well, I know what that means. According to the DSM, it says, this, that, and the other. It is useful in research when trying to do some troubleshooting and problem solving. And another one is that clients often feel relieved that they could identify, I have this thing, it actually has a name, it actually has a title. Okay, that makes sense. I get that. And it's a relief once they know that what they are suffering from does have a name to it. Let's talk about one that maybe some of you have heard of. ADHD stands for Attention Deficit Hyperactivity Disorder. It's marked by extreme inattention and or hyperactivity and impulsivity. ADHD, and many of you have heard of this because it's now brought up a lot in elementary schools. Critiques fear this disorder is overdiagnosed, leading to an overuse of prescription drugs. And that has come up a lot, and I've heard a lot of people mention this criticism. Those who say ADHD is overdiagnosed argue that the symptoms displayed sound like the disorder of just having the Y chromosome, which means ADHD is 3 times more prevalent in boys than in girls. What they're saying is that, really, you're just diagnosing being a little boy. Because being a little boy means you want to run around, you want to have fun, you can't sit still. You get bored in the classroom, you want to be active. So that is one critique. ADHD may in effect be marketed by companies that offer drugs for its treatment. Okay. Energetic child plus boring school equal ADHD diagnosis. So there are some of the critiques. Now let's talk about anxiety disorders. Anxiety disorders And here we see a picture of Vincent van Gogh, by the way. Anxiety disorders, distressing, persistent anxiety, or maladaptive behaviors that reduce anxiety. So you could do something that is unhealthy or physically disturbing that helps reduce anxiety. And we're going to elaborate on some types of anxiety disorders. Let's talk about generalized anxiety disorder. A person is unexplainably and continually tense and uneasy. They worry continually, they're often jittery, they're on edge, and they are sleep deprived. They have trouble concentrating on a task. It affects 2/3 of women. And, there are medications for this, and it's a very fine line when you have to self-diagnose whether you do have generalized anxiety disorder or you're just going through something that is a phase because, you're going through a transition in your life. Anxiety is free-floating. It's not linked to a stressor or a threat. So if you are going through a transition, you need to be aware, well, maybe I'm just going through this transition, right? A new school, a new relationship, what have you. But if it's not linked to anything, well, then that could be a sign of generalized anxiety disorder. Often seen with depression, but usually debilitating even on its own. May lead to physical problems like high blood pressure. Then there is panic disorder. These are sudden episodes of intense dread. Panic disorder, again, can be given a medication and to help squash the sudden episodes of intense dread. And it's up to the individual to decide if they think they have a panic disorder, or are they going through something traumatic that is simply a phase? Physical symptoms accompany the attack. Irregular heartbeat, chest pains, shortness of breath, choking, trembling, dizziness. These are the things to be aware of if you think you know of someone that has a panic disorder, or if even in yourself and you need to self-diagnose. Then there are phobias. Person is intensely and irrationally afraid of a specific object, activity, or a situation. Many people are aware of the term phobias because they've heard of some of the more common phobias that exist, like arachnophobia, fear of spiders, ophidiophobia, fear of snakes, acrophobia or acrophobia, fear of heights, agoraphobia, the fear of situations in which escape is difficult. So these are some of the more common types of phobias. However, there are many more, and it is something that you need to be aware of. If it's something that is very specific, then you are now self-aware that you could suffer from a very specific phobia.